Hi, folks. Today is Thursday, May 7th, and we have some new information to share. In the memo last night, talked about the results that we had gotten back from our Birch Hill campus in Manchester. We do have additional positive residents in our healthcare center, which is disturbing and not surprising. We had tested 14 healthcare residents. Of those, 13 of those had symptoms, and one person had tested positive in our first go-round but never developed symptoms. That person tested negative, and additionally 3 more people of the 13 tested negative. So 10 positive residents there. Of the 7 folks who initially tested positive, 4 have passed away, and 3 have recovered. So this continues to be just a difficult virus to get ahead of, but we are working at it every day. I can tell you that I am more proud of that team than you could imagine, because it's pretty tough to go to work every day and put on full PPE, gown, goggles, mask, and have that on for 8 straight hours, changing it out in the safest way, but a lot of it is alternative PPE too. So these are tough times. In addition to our residents who tested positive, we had 9 staff members test positive. 2 were symptomatic and hadn't been on site for a few days, but the other 7 were asymptomatic. I'm so grateful that we're doing this testing, because it allows us to try to stay a step ahead, to keep any of the spread, even though it does seem to continue, but it's continuing at a much slower pace than what some other communities are experiencing, because we're doing the testing, because we're trying our best to stay ahead of it. So the other kind of good news is that folks who tested positive initially on the staff side, we had in our initial testing, we had 5 asymptomatic people and 4 asymptomatic people. They're all back at work. We had 3 folks who were symptomatic, and 2 of those 3 are back at work. So what we're seeing is that the virus is tricky and hard to stay ahead of, but we're doing our best, and we are starting to see people recover and come back and be healthy. So that's good. We're beginning to see results come in for our Tuesday testing, and that was RiverWoods Durham and RiverWoods Exeter residents and a few staff members. So far, all of those are negative, but we are still missing some results, so we expect those will come in over the course of the day today, Thursday. Some what I think is really great news. Yesterday, the Department of Public Health announced that the state will start a testing program for long-term care facilities, where long-term care workers can get tested on a rotating basis every 7 to 10 days. And I think that is fantastic. That's what we've been pushing for. Actually, I'd like it every day, but at this point that seems a little greedy, so I'm going to take our small wins at this point. This would be like 24 to 36 hour turnaround testing, which is good. The next step is to get to that rapid testing. Like there are certain machines that can do that now, but there aren't enough test kits. But to be able to get you test results in 15 to 30 minutes. And I do think, short of us having an antiviral or a vaccine, that's where we're going to need to get to. So this is progress. This is a step in the right direction. It's what we've been working on and asking for, and we're excited that the Commissioner of Public Health is on that. She's very communicative with our industry, so we're excited about that. The last thing I want to touch on is just sort of the opening up of the community and the fact that Sunday is Mother's Day. I know it's getting close, it's getting tight in here, and the executive directors put out memos yesterday to talk about ways that we can think about on the independent living side of doing a little more within our campuses to start. So ways that we can start to have more social activity, more togetherness from 6 feet away. Just want to touch on a few things about being together. Being together stationary 6 feet away. If you're sitting with someone and talking and having a drink 6 feet away, you've got your distance, you don't need to be wearing a mask. But when you get up to move around, put your mask on. If you're moving around the community where you think there's an opportunity to be around other people, put your mask on. Keep it with you. If you're outside walking and you don't have a mask on, but you're coming back into your building, put your mask on. These are, it's a simple thing. It might be an annoying thing. I know for some folks, it's a little bit of a breathing thing. But 2 options. Be sure and ensure that you can keep 6 foot social distance from folks, or have your mask on. And if you can't be sure, the mask is a good backup. It's a protection for the person you're talking to, not necessarily a protection for you. So that's sort of my masking and social distancing spiel. But as we start to think about doing more things in the community, that's what I hope is in your head, that if you're going to a place to be with some other people, no more than 6, maybe 4, have your mask on. When you get there and you're properly distanced, you can take it off. I also like to talk about when we are together. So if you're going to get together with folks and have a conversation or have a happy hour, remember they used to talk about BYOB. Go to a restaurant, bring your own booze. My mindset is BYOE. Bring your own everything. Bring your own glassware, silverware, glass, wine, snacks, whatever. And this isn't a time for sharing, even though your mom probably taught you, like mine did, to share. Now's not the time. So if you are going to be together in a group of people, you have to bring your own stuff so that we're not touching one another's things for right now. That's how, or it's at least an opportunity for the virus to get transmitted. And it's not an opportunity that we need to take, and so it's not one we should. The last thing I want to talk about is Mother's Day. That's Sunday. And, the weather's starting to get great, and I know people want to see their families, and I know people want to sort of bust out of our campuses, but we're not ready yet. The states are starting to open up, and that sort of inspires us. But as your executive directors have said, and as I've said, we're going to lag the states. As the states start to open up, transmission will spread. And we don't want it to spread to you. And we sure don't want it to spread to you and have you come back to campus and have it spread to someone else. So anytime you leave the campus, we're still in the self-quarantine period of 14 days. Now, with Mother's Day, that's a tricky one because everybody wants to see their mother, or if you are a mother, you want to see your kids. And this is what I want to tell you. We're not quite ready yet for that kind of visitation. We'll get there. I promise you we'll have Mother's Day. It's just not going to be Sunday, May 10th this year. Your kids will still love you in June or July or August when we can feel really comfortable that people can be here. And in between here, now and then, we will find ways to have visitors on campus safely, outside, without touching any germy people. We did pilot a program at our Durham campus, and it seemed to work well, but we need a little more time to work out the kinks for the other campuses. So I guess what I would ask you is for patience. Hang in there. We're learning so much, and we've learned so much over the course of the last 9 weeks about ourselves, about our communities, about our family of communities, about work ethic and commitment, and about how committed we all are to you and your health and safety. And to be honest, we just don't want to screw that up now. We don't know when this will be all better, but we do know that we're working every day to find ways for you to have more life and a broader life in a way that's safe and healthy for you and for your neighbors. So hang in there. And if you are a mother or had a mother, that would be everybody, unless you're a test tube baby, which, I don't think anyone was. Happy Mother's Day. Stay safe, stay healthy, wash your hands, enjoy this beautiful day. Love you. So long.